Good evening, all. So we are here for the most awaited part of the annual conference, and this is Dr. Tomisaku Kawasaki Oration. So I'll introduce the Dr. Tomisaku Kawasaki in the name which we have oration, and I think this is the singular honor to Indian Society of Kawasaki Disease that we have named oration in the name of Dr. Tomisaku Kawasaki. So Tomisaku Kawasaki was born in February 7, 1925 in Tokyo, Japan. He was graduated from Chiba Medical College, Chiba, Japan in 1948. From 1948 to 1949, he was interned at Chiba Medical College Hospital, Chiba, Japan. And from 1949 to 1950, he was working at Department of Pediatrics, Chiba Medical College, Chiba, Japan. He was from 1968 to 1973, he was Assistant Director, Department of Pediatrics, Japanese Red Cross Central Hospital at Tokyo, Japan. Was Director, Department of Pediatrics, Japan, Japanese Red Cross Medical Center at Tokyo, Japan from 1973 to 1990. And he was Director from 1990 to 1995, Japan Kawasaki Disease Research and Guest Professor at Kurume University. He was a Chairman of Kawasaki Disease Research Committee sponsored by the Ministry of Health and Welfare of Japan during the 1974 to 1977 and 1983 to 1991 years. He was a chairman of the Third International Kawasaki Disease Symposium during the 1988 symposium. He reported his cases as a possible new disease at a pediatric meeting in the Chiba and Tokyo first time. These initial presentations met with a lot of oppositions from his academic peers who thought that he was describing was nothing other than Still's disease or Stevens-Johnson syndrome. Dr. Kawasaki, however, had the courage of conviction to stand by his initial observations, and he was convinced that this was indeed a new disease entity. He collated data on 50 such cases and in 1967 published a big article in Japanese Journal of Allergy covering 44 pages and had beautiful color illustration that he had painstakingly collected. This original publication is still considered to be a masterpiece of accurate clinical observation and continue to be cited even 50 years after this publication. He had received several awards and honors and distinction in Japan and elsewhere. In 1989, he was nominated as a lecturer for the prestigious Duckett Jones Memorial Lectureship by the American Heart Association. This is a very singular or an honor for any pediatrician or pediatric cardiologist. He was also invited to attend the meeting as it was read by Dr. Kato that he was there at that time. So he was said that he was also there, and Dr. Kawasaki received a standing ovation after this lecture, which is a very singular and very honor in this situation. So thank you. Now may I request Dr. Tapas Sabui sir for introducing the orator of the day.
Again, good evening, everybody. And it's my privilege to introduce again with Professor Surjit Singh to the audience. Professor Surjit Singh started his medical journey from MMC, New Delhi. He got his MBBS from that institute. Then he got his MD from PGI Chandigarh. Then he did a DCH from London, followed by FRCP there, then FRCPH, FMC, and finally fellowship in pediatric immunology in London. Professor Surjit Singh, formerly head of the Department of Pediatrics, Chief Pediatric Allergy Immunology Unit, Advanced Pediatric Center, Dean Research, PGIMER Chandigarh. This is a 300-bedded hospital facility providing specialized care to children. There are 593 research publications in his credit in a peer-reviewed journals with citations 12,557, high index 52. He was ranked amongst top 2% percent scientist of the world as per Scopus Stanford ranking of global scientists 2023. He set up a pediatric immunology unit at PGI in 1993. This is the first and till date the only such unit in India. He initiated DM program in pediatric clinical immunology and rheumatology in 2014. This is the only such course in India. And many of our students now today is the faculty of this conference. And he positions responsibilities in national institutes. He nominated members, institute body and governing body AIMS Raipur 2020 to 2025. Member of institute body AIMS Bhatinda, chairperson academic committee AIMS Raipur, members of institute body All India Institute of Medical Science Bhatinda, nominated member postgraduate board of studies AIMS Bilaspur, member governing council Indian College of Pediatrics 2020 to 2023, member postgraduate medical education and medical council of India 2012, member board of studies in pediatric MCI 2011. Academic responsibility he had taken still at PGI Chandigarh. He has 15 years administrative experience, officiating director PGI November 2021 to May 2022. He was Dean Research PGIMER. He was also Chief Vigilance Officer there, Deputy Director of Administration and the Joint Medical Superintendent Procurement, Member Education Committee of PGI, Secretary, Staffs Council, Deputy Medical Superintendent, Advanced Pediatric Centers of PGI. International honors he received: Coordinator for World Health Organization, Collaborating Center for Education, Research and Training in Pediatric Immunology 2022-26. Only center of its kind in the world, President, Asia Pacific Society of Immunodeficiencies, Coordinator, Asia Pacific League of Association of Rheumatoids, popularly known as APLAR, Center of Excellence. The first and only such rheumatology unit in India to be so accredited, Coordinator, Asia Pacific Society of Immunodeficiency, Center of Excellence, 2023 to 2026. Coordinator, Center of Excellence, Asia Pacific Association of Allergy, Asthma and Council and Clinical Immunology. He delivered orations, Roland Levinsky Memorial Lecture, Hong Kong Society of Immunology, Allergy and Infectious Disease, Hong Kong 2016. Stuart Gann Memorial Lecture, 2019, Singapore Pediatric Society. Dr. Cyrus Oration, UAE twice in 2021 and 2023. Levian Award 2022, International Patient Organization for Primary Immunodeficiency in Sweden. Yuki Lin Takahashi Memorial Lecture, International Symposium of Kawasaki Disease, Montreal 2024. Other miscellaneous international honors he received: he was the co-editor, Nelson Essential of Pediatric, first South Asian edition 2016, Editor-in-Chief, World Journal of Clinical Pediatrics, Associate Editor of International Journal of Rheumatic Diseases, Associate Editor, Pediatric Discovery, Review of Editor for Pediatric Immunology, as well as for the Primary Immunodeficiency for Frontiers in Immunology. He is selected visiting professor in pediatrics, BP Koirala, Institute of Health Science, Dharan, Nepal, Department of Pediatrics. Also from the Xi'an, China. National honor he received: Coordinator, Indian Council of Medical Research Collaborating Center of Excellence in Pediatric Immunology, Principal Investigator, ICMR, Center for Advanced Research in Primary Immunodeficiency Diseases. This was the first such center in India, designated as IRA Master by the Indian Rheumatology Association. ICM Awards, he has received Chaturvedi Kalavati Jagmohan Das Memorial Award by Indian Council of Medical Research 2009, Chaturvedi Kalavati Jagmohan Das Memorial Awards by ICMR 2011, and Amrut Modi Unichem Prize by ICMR. Orations he has delivered innumerables. Let me read out. Awarded James Plate and Warren Prize and Gold Medal in 1985 by Indian Academy of Pediatrics, Jairus Oration, IRA Oration 2010 by Indian Rheumatology Association, Dr. Raju Gold Medal 2004 by Indian College of Allergy and Applied Immunology, Balu Atre Oration 2016 of Pediatric Rheumatology Society, Bangalore, delivered the P. Dange Oration, Nagpur 2005 and 2015, Tirumala Rao Memorial Oration, Visakhapatnam 2008, H.K. Gaur Oration, Surat 2011, Dr. K.C. Chaudhary Oration, Kolkata 2013, Dr. Sisir Kumar Bose Oration at Diamond Jubilee Celebration of ICH, Kolkata 2016, Dr. D.G. Venkappa Endowment Lecture, Bangalore Pediatric Society, Bangalore in 2017, Annual Rheumatology Oration at Christian Medical College, Vellore 2017, Dr. Nirmal Migalani Oration, Jaipur 2018, Dr. B.N. Dasgupta Oration at Annual Meeting of Indian Academy of Pediatrics, Bihar, Gaya 2019, Dr. T.S. Males Memorial Oration, Bangalore Pediatric Society, Bangalore 2020, Dr. H. Parmes and Dr. Nagarju Oration of Applied Allergy and Applied Immunology Chapter, Indian Academy of Pediatrics 2020, Professor B.N.S. Walia Oration, Indian Academy of Pediatrics, Chandigarh 2021, Professor R.N. Nath Oration, Bhubaneswar 2022, Dr. Ajay Joshi Oration, Pune, Dr. Mahorshi Chakra Oration, Kolkata 2023, Professor Manas Mukherjee Memorial Oration, Kolkata 2023, Dr. Ashok Kapse Oration, Surat 2023, Dr. M.B. Patil Oration, Vijaypura 2023, Society of Inflammation and Research Oration, Bengaluru, Professor Devasis Janda Memorial Lecture, Vellore 2025, Dr. S.P. Ghoshal Memorial Oration, Kolkata 2025, Central Zone and Telugu Pedicon Oration, Guntur 2025. Miscellaneous national honors he has received. So, for Vice President, Indian Rheumatology Association 2017 to 2019, President, Indian Society of Primary Immunodeficiency 2013 to 2014, Convener of National Immunization Committee of Indian Academy of Pediatrics, President, Pediatric Rheumatology Society of India 2005 to 2006, Member Advisory Committee of Vaccines and Immunization IAP 13-14, Coordinator for a Global Initiative of Academic Network, Gyan Program, Ministry of Human Resources Development, Government of India 2019 and 2023, President, Indian Society of Kawasaki Disease 2020 to 2022, is Adjunct Professor in Pediatrics, Department of Pediatrics, Kaustubha Medical College, Manipal Academy of Higher Education, Bangalore 2018 to 2021. So, from this you can imagine how academically brilliant person is Professor Surjit Singh and how knowledgeable person he is. Professor Surjit Singh, its diocese is yours.
Okay, good evening. May I have the first slide, please? So, the state of Kerala, I think, has been at the forefront of the emergence of Kawasaki disease in India. And we owe a lot to this state, especially to the pioneers like Dr. Zulfikar Ahmed, Dr. Noel Narayanan, and later Dr. Saji Philip, for spreading the word about Kawasaki disease, first in the state and then across the country. So just briefly about Dr. Kawasaki, he was born on 7th February 1925 in Asakusa, Tokyo, studied at the Chiba Medical School from 43 to 48, and in the 50s found himself at the Japanese Red Cross Medical Center as a staff pediatrician. He had the option of joining a teaching hospital, but at that time he chose to work here at the Japanese Red Cross Medical Center. Something pulled him here. And this is how the hospital looked like at that time. This is a picture from the 1960s, one of the wards of the Japanese Red Cross Medical Center. And in the early 60s, as Ms. Subura Kawasaki showed, he was working there with his mentor, Dr. Naito. And this was the time when he came across this 4-year-old boy by the name of Shunichi Yamazo. And in his own words, I could make no diagnosis of this unusual sickness for which I could find no reference in any medical literature. I presented this case at a clinical conference in the hospital. One doctor suggested it was atypical scarlet fever, but I knew it was not. Finally, the case was released as being of unknown diagnosis. By 1967, he had collected not 50, but 52 such patients. This publication is of 50 such patients. So if you read this article, this runs across 44 pages. It is full of illustrations and very meticulously drawn clinical notes. In a subsequent publication by Dr. Kato, which he published when Dr. Kawasaki passed away in 2020, Dr. Kato mentions that he had 2 more patients who had died. And these 2 patients who had died had been diagnosed as infantile polyarthritis nodosa on autopsy by the pathologist. But Dr. Kawasaki at that time, since he was not aware of the cardiovascular sequelae, he had excluded these 2 patients. So he published the first 50 patients of the mucocutaneous lymph node syndrome. This was a single author paper because Dr. Kawasaki, his mentor, he said that this is your work and you should publish it under your name. So that is how Dr. Kawasaki published this paper in the Japanese Journal of Allergy. It was in 1974 when he published his first English language paper, and it was this paper which brought him immediately international recognition. 2 years later, Dr. Marian Mellish and pediatric rheumatologist Dr. Rakesh Hicks also reported a similar disease from Hawaii, and Dr. Kawasaki and Dr. Marian Mellish then started working together, writing to each other, and they knew that what they were reporting from 2 different continents was the same disease. This is Dr. Kawasaki in the late 70s when he started lecturing on Kawasaki disease. This disease entered the Nelson textbook of pediatrics in 1979. And when we were medical students in 1980, postgraduate students in 84, 85, there was just a paragraph on Kawasaki disease in the Nelson textbook of pediatrics. It was first presented at an international conference in Barcelona at the 16th International Congress of Pediatrics, and Dr. Kawasaki soon realized that he would turn out to be a very, very busy participant because he had to autograph virtually hundreds of delegates. Just to complete the historical perspective, the first use of IVIG in Kawasaki disease was by Dr. Ferruccio from Kyoto, and this was just by serendipity because by that time, IVIG had been used in immune thrombocytopenia, and Dr. Ferruccio said, if it can be effective in immune thrombocytopenia, KD also perhaps is an immune disease, so why not try it in this condition? And that is how IVIG started being used. And of course, it was in 1986 that Dr. J. Newberger published the first double-blind study. As far as the recognition of and emergence of KD in India is concerned, this disease was first reported from New Delhi at the Gangaram Hospital, Dr. Arvind Taneja. He had seen a similar case while he was working for his fellowship at Boston, and that is how he picked this up. The second case was a doctor's child from Pune, from the Ruby Hall Clinic in Pune, reported by Dr. Nitsure. And in 89 was the third case from Christian Medical College, Vellore. This was a 14-year-old boy, relatively older boy with Kawasaki disease. In February 1994, Dr. Kawasaki had come to attend the 8th Asian Congress of Pediatrics in New Delhi. And there was a session on childhood vasculitis where they were discussing vasculitides like Henoch-Schönlein purpura, Takayasu arthritis, polyarthritis nodosa. So he was sitting at the back of the hall, and at the end of the session, he got up and asked, do you see Kawasaki disease in India? No one knew who he was at that time, unfortunately. And the chairperson said, no, this disease doesn't occur in India. So he said he came back from India rather disappointed that such a large country and there is no Kawasaki disease reported from here. As luck would have it, a few months later, we encountered in June 94, that means 4 months later, we encountered our first patient of Kawasaki disease at Chandigarh, and we used intravenous immunoglobulin for treatment of this patient. And this was the first time that IVIG was used for KD in India, and we published this in 1996. In February 97, Dr. Noel Narayanan, who had been compiling these patients at Trivandrum, he published the first series on Kawasaki disease from India. At that time, we were not aware that Dr. Narayanan is also encountering these patients. But in few months later, in September 97, we reported our small series on KD. So it was just by chance that in 1997, the first two series on Kawasaki disease were reported from North and South India, two centers which are separated by almost 2,500 kilometers. So by 1997, we had 3 case reports. We had used IVIG for the first time for treatment of KD, and we had 2 case series published in the Indian Pediatrics. Between 1997 and 2005, many other centers started reporting Kawasaki disease, notably Kolkata, Bangalore, Hyderabad. So many regions started reporting KD. But the real change occurred in 2005-2006, which for many of us were the watershed years for Kawasaki disease in India, because it was at this time that we had visits by 4 overseas experts who virtually transformed the perspective of Kawasaki disease in India. And these experts were none other than Dr. Tomisaku Kawasaki himself, Dr. Hiroi Sakato, Dr. Marian Mellish, and Dr. Jane Burns. The thing started with a letter that we wrote to Dr. Kawasaki. So this was a formal letter, because at that time we didn't have access to his email ID. So we just wrote a letter to him, and this letter has been retrieved by the help of Ms. Subura Kawasaki. And in response, so we invited him to Chandigarh. He asked, "Are you now seeing KD in India?" Because he remembered his 94 visit. So we said, yes, we are seeing KD in India. And we also sent him some of the publications on KD from India. So his response was, "I'll come. And I'll bring my good friend, Dr. Kato, also along." So this was Dr. Kato and Dr. Kawasaki in October 2005 at Chandigarh. We had the good fortune of both of them coming here together. And this is Dr. Kato and Dr. Kawasaki delivering their orations at our institute. And this is Dr. Kato, Dr. Kawasaki, and Dr. Marian Melish interacting with parents of children with Kawasaki at Chandigarh. And we also had Mr. Greg Chin from Boston. He had founded the KD Foundation USA. He had also come over to participate in this conference. With so much happening in India, suddenly there is a spurt of publications from virtually all parts of our country, with Dr. Kawasaki coming to India, Dr. Kato coming to India, Dr. Melish coming to India. This attracted the attention of Dr. Jane Burns. She said there is something wrong. Why is so much KD suddenly appearing in India? So she organized a team of researchers from the National Library of Medicine and the Emory University. And she came to India and she visited all the centers from where there were reports of KD. So she started her trip from Chandigarh, went to Delhi, went to Mumbai, went to Trivandrum, met Dr. Noel Narayanan, met Dr. Zulfikar Ahmed, and Kolkata she couldn't, because of shortage of time, she spent more than 10 days at that time, but she held a video conference. Now coming to think of it, this was 2006. I really don't know how she organized a video conference because that was not the time of Zoom. But she organized a video conference and she interviewed all the doctors who had been reporting Kawasaki disease from Kolkata. And based on this visit, she wrote 3 publications on her experience of KD from India. This is Dr. Kawasaki interviewing the doctors. This is Dr. Zulfikar Ahmed. And she painstakingly recorded these interviews, and these interviews are still available on the University of San Diego website. You can still hear you'll see the videos and the audio. So based on her experience, she reported that KD appears to affect an older age group in India. There is a strong male preponderance, and periungual desquamation and thrombocytosis appear a little earlier in India. So this was Dr. Jane Burns based on her experience of KD in India. So between 1997 to 2006, there was increasing diagnosis amid widespread skepticism. There was still skepticism about this disease in parts of our country, but slowly it began being accepted as a valid diagnosis. This was the time when incomplete and atypical cases started getting reported, and we owe all of this to the visits of Dr. Kawasaki, Dr. Kato, Dr. Melish, and Dr. Jane Burns. Between 2006 to 2010, I think there was a quantum leap in the diagnosis. There was a consolidation phase in the Indian literature. Atypical cases started being diagnosed, started being treated. The first coronary artery bypass for KD was reported from India. And this was also the time when other therapeutic options started being used in Kawasaki disease. So by 2015, there were several centers that had extensive experience of Kawasaki disease. including the three main cities of Kerala, Trivandrum in the south, Kochi in the middle, Calicut in the north of Kerala, Chennai, Hyderabad, Mumbai, Calcutta. Several cities now were comfortable reporting Kawasaki disease. This can be exemplified by this very unique CME held in Kolkata. So, Kolkata, the Pediatrics Fraternity holds a meeting on 1st of May every year, that is International Labour Day. So this CME was in pediatric rheumatology, and the entire day was spent on Kawasaki disease. This meeting was very special because we had several adult rheumatologists in the audience, led by, of course, Professor Sukumar Mukherjee. And he was there for the entire day hearing about Kawasaki disease. We really felt very honored having Dr. Mukherjee spend the entire day with us. The other thing very special about this CME was that the only topics that were discussed were unusual KD, atypical KD, how do I treat unusual KD, how do you treat atypical KD, as if typical KD by that time was very clear to everyone. So in a way, this CME exemplified the knowledge about KD in our country in 2015. We have obtained several insights from our own academic visits while working on this Kawasaki disease. And of these, I have very fond memories of our own visits to the Japan Kawasaki Disease Research Center in Tokyo, starting in 2008, when we wrote to Dr. Kawasaki, and he was gracious enough to host us at his center. And this is a photograph taken from the outside of the center. And we were met with Dr. Kawasaki and Ms. Norika Sato and Ms. Yasuko Fujinami, who worked for many years with Dr. Kawasaki. And the gentleman in front is Mr. Asai. Mr. Asai's son had developed Kawasaki disease at a time when IVIG was not available, and he had died. And he ran the Parents Association for Kawasaki disease, and he worked closely with Dr. Kawasaki disease for many, many years. During this visit, I requested Dr. Kawasaki that I would want to see the Japanese Red Cross Center, and he was gracious enough to say yes. And we went by the Tokyo Metro. This is a photograph of Dr. Kawasaki while coming out of the metro station. This is Dr. Kawasaki standing in front of the Japanese Red Cross Center. We went unannounced. And this is again Dr. Kawasaki at that hospital. And since we went unannounced, there was a commotion created in the children's wards of that hospital. And suddenly there was everyone around saying, Dr. Kawasaki has come. So the residents there, understandably, were very excited. My second visit was in February 2010. And this was the time when we had long discussions on his own struggles with getting to the diagnosis, how he diagnosed it, how his initial efforts in convincing the government that this is something which is very serious. And this was also the time when he arranged me to visit Dr. Yoshihiro Onuchi at the Riken Institute in Yokohama. And Ms. Fujinami accompanied me all the way from Tokyo to Yokohama. And according to Dr. Kawasaki, if there is anyone in this world who will ever discover the etiology of Dr. Kawasaki, it would be Dr. Onuchi. Our third visit was in last year, and this is, of course, after Dr. Kawasaki had passed away, and it looked surreal attending, coming to the center and we were received by Ms. Subura Kawasaki and Dr. Yoshio Emada, who is now the director of the Japan KD Research Center, and Dr. Rakesh Pilania and Dr. Manpreet Dhaliwal were also there during this visit. This center has a lot of memories associated with Dr. Kawasaki, lot of his research work, and lot of information about how the disease evolved. So this is, in a way, the Makkah of Kawasaki disease research the world over. In 2012, I had an incidental meeting with Professor Paul Bacon, a renowned rheumatologist from the United Kingdom. And while discussing, he asked me, do you know where the oldest sample of a coronary aneurysm is kept? So I said, no, I don't know. So Dr. Bacon said, this is kept at the Barts Hospital in the United Kingdom. He knew it because he himself was an alumnus of the St. Bart's Hospital in London. So Dr. Paul Bacon very kindly arranged a visit to the museum and to the library of the St. Bart's Hospital in London. And I had access to the Journal of the St. Bart's Hospital, published in 1871, which is the world's earliest published description of coronary artery aneurysms. So these were reported in a 7-year-old boy who had been admitted to the hospital for sick children at the Great Ormond Street. So this journal is still there. The museum specimen in the anatomy department, we could not access because the curators at that time, they were on strike. But this specimen is kept there showing coronary artery aneurysms. Of course, at that time in 1871, no one knew what this was. But this is the world's oldest specimen of coronary artery aneurysms because of Kawasaki disease, kept in St. Bart's Hospital. In 2014, I had the occasion to visit Osaka for a conference, and I requested Professor Kato if I could visit the National Cerebral and Cardiovascular Center, which is the topmost cardiovascular center in Osaka, and he very kindly arranged a meeting with Dr. Etsuko Suda at the NCVC, and this was the first time I realized what imaging in Kawasaki disease really means. Dr. Suda has follow-up of imaging done in these patients carried over several decades. We have been collating data from PGI on our experience of CT coronary angiography, which we feel is an essential imaging modality in Kawasaki disease, but this may not be the viewpoint of several other centers. And Dr. Manful Singhal, who virtually pioneered this radiation optimized CTCA scans since starting in 2013. So he has been publishing his experience on CTCA. At PGI now, we have one of the world's largest series on CTCA in KD, and he had the opportunity to visit the NCVC in 2023, and he was hosted there by Dr. Suda, Dr. Kitamura, who many of you would know. He's the world's leading surgeon, cardiothoracic surgeon for coronary artery damage. And at one of the KD's, international KD symposia, I remember an American surgeon saying, we can't do what Kitamura can do. So he used to work at Osaka. So Dr. Manful had the opportunity to spend 1 whole month at Osaka sharing his experience on CTCA with Dr. Suda, with Dr. Kitamura, and then he also spent a few days with Dr. Mitani at the Me University. Dr. Manful also had a chance to visit the Retd Children's Hospital in San Diego and shared his experience on CTCA with Dr. Jane Burns. And at one of his talks, Dr. Jane Burns told him, Manful, why don't you come along and base yourself in San Diego? But before you come, get your machine along. Recently, he had the chance to visit Dr. Ramnan at Bristol and share his experience on CTCA. This is an imaging modality which is still not being used in most countries. But based on whatever little we have seen, we think that echocardiography is not enough for assessing the damage done by Kawasaki disease. It grossly underestimates the damage that this disease can do. The Indian representation at the International Kawasaki Disease Symposia, these are held once every 3 years. So the last symposium was held in Montreal in 24. The next would be held in Chiba in 27. So I attended the first IKDS in 2005 at San Diego. And this was the first time I had the opportunity of meeting Dr. Kawasaki. And at this symposia, there were just two representatives from India, Dr. Saji Philip and me. The next was held in Taipei. Again, there were just two representatives from India and a couple of presentations from India. Dr. Saji and I were the only two people. Kyoto, again, there were only two people from India. But by 2015, the Indian participation at these symposia had increased significantly. So this is Dr. Kawasaki at Honolulu with his family. And this is Dr. Kawasaki with some of our residents. So this is Dr. Sagar, Dr. Sharma here. And of course, Dr. Manful. In the Yokohama symposium, we had almost 20 participants from India, and there were several oral presentations from India, including one by Dr. Priyankar Pal. And almost 10% of all the abstracts presented at Yokohama were from India. So our participation had increased significantly. This was the last meeting of the IKDS which we attended with Dr. Kawasaki. Dr. Kawasaki used to sit in the center of the hall from morning right till the end of the session, all 4 days of the meeting. And he, of course, was the center of attraction. There would be chairs on either side. People would come and get themselves photographed with him. And this went on from morning till late in the evening. This is this IKDS where we have a recording of his voice when he
第12回国際川崎病シンポジウムは2018年9月12日から15日までパシフィコ横浜で開催されます。未だに原因が明らかでない川崎病について小児科だけでなく様々な領域の研究者が世界中から集まり4日間にわたって熱い討論がなされます。熱い討論の後には、横浜でならではの雰囲気と美味しい食事を楽しんでください。数多くの皆さんが国際川崎病シンポジウムに参加されることを希望します。横浜でお目にかかりましょう。 以上。
So this again, Dr. Kawasaki being felicitated by Dr. Jane Newberger, Dr. Jane Burns, with Ms. Subura Kawasaki and her sister, and with some of our residents here. And these are the winners of the Young Investigators Award. And this is a photograph, I think, which all these investigators will remember for the rest of their lives. And there were 3 winners in this photograph from India. The 21 IKDS had to be held online because of the COVID pandemic, and this was also the first IKDS which was held after the passing away of Dr. Kawasaki. Last August, we had the 14th IKDS in Montreal, and of course, this meeting looked very different because without Dr. Kawasaki, I think the soul of the IKDS is in a way missing. India is one of the few countries that has national standalone meetings on Kawasaki disease. And we owe this again to the state of Kerala. Dr. Saji Philip founded the Kawasaki Disease Foundation in 2010, and he started with annual Kawasaki Disease Summits, and the first summit was held in 2010 at Parumala, where he invited his own mentor, Dr. Louis from Taipei, for this meeting. The second summit was held in Chennai, where we had Dr. Takahashi and Dr. Ming Tai Lin from Taipei. And of course, this is Dr. Cherian, the renowned cardiothoracic surgeon, who was one of the hosts of this meeting. The third Kawasaki Disease Summit was held in Chandigarh, where we had again Dr. Jane Burns and Dr. Mellish for their second visit to Chandigarh. And we also had Dr. John Gordon from San Diego. And the 4th, 5th, and 6th summits were held in Guwahati, Bangalore, and then in Chandigarh again, all across the country. In 2018, we founded the Indian Society of Kawasaki Disease, and for this I am indebted to Dr. Priyankar Pal, Dr. Tapas Sabui, and Dr. Rakesh Mandal from Calcutta for taking up this initiative. And since 2018, we have been having conferences of the Indian Society of Kawasaki Disease. So from National Kawasaki Disease Summits, we now have annual conferences of the Indian Society of Kawasaki Disease, starting from Chandigarh in 18, then Kolkata 19. Second and third had to be held virtually because of the pandemic. 5th in Hyderabad, 6th, 7th at Patna, and 6th again at Chandigarh. In 2017, we had taken permission from Dr. Kawasaki, and he very graciously allowed us permission to organize the Tomisaku Kawasaki Oration. And for the first oration, we invited him to suggest an orator, and he suggested the name of Professor Yoshihiro Onuchi, who delivered the first Dr. Tomisaku Kawasaki Oration at Chandigarh. The second one was delivered by Dr. Hara. The third and fourth had to be delivered online, and these were delivered by Dr. Takahashi and Dr. Suda. The fifth one was by Dr. Miura at Hyderabad. The sixth one at Chandigarh by Dr. Hamada, and the seventh one last year at Patna by Dr. Ayusawa. India has been publishing reports on Kawasaki disease, as I said, since 1977, but the real push came in the 1990s. So we figure reasonably high as far as KD research is considered, and India figures fourth in the top 10 countries as far as publications on Kawasaki disease are concerned. So we have published more than 500 papers on Kawasaki disease from India. The part of the bar which is in red, this shows multi-country, multinational publications. The ones in blue show publications from within the country itself. So there are many important publications that have come out from India, but I would just mention a few. This is a paper by Dr. Saji Philip, and this was published in 2004 based on his PhD thesis, published in Pediatric Research. And this was perhaps the first basic science publication, major basic science publication from India, published in 2004. Dr. Saji Philip, as you all know, worked on developing the animal model for Kawasaki disease for his PhD in Taipei. This was his second publication, again, strictly basic science publication, which he published in 2014. This is a publication from Dr. Priyankar Pal, which in a way was a new finding. Orange-brown chromonychia seen here on the nails during the acute phase of Kawasaki disease. And he first presented this as a poster at one of the ISKD meetings. And then this was published as an original article. And this finding has subsequently been reported from other countries as well. Dr. Priyankar Pal's group has been also working actively on the correlation between KD and MIS-C, and this is one of their important publications on the role of these two biomarkers in differentiating KD from MIS-C. And this particular publication was one of the top downloaded articles of the International Journal for Rheumatic Diseases for 2022. From Chandigarh, we have been publishing data on Kawasaki disease, epidemiological data, and in the 24 publication, our figure stands at 10.6 per 100,000 children below 5, and this we have recently updated the data. This figure now is much higher than 10.6. This was a publication, again from Chandigarh, on concurrent infections in children with KD. I consider this an important publication because it just shows that you should not exclude the diagnosis of KD if you are seeing clinical features of Kawasaki disease, and concurrent infections were seen in 10% of patients with KD at Chandigarh. These are two publications by Dr. Manful Singhal, which in a way changed the perspective of this investigation, CTCA, in Kawasaki disease. And we believe that this investigation is likely to figure in a much more important manner as far as imaging of Kawasaki disease is concerned. So this is the first publication published in Rheumatology, Oxford, on distal coronary artery abnormalities. And this publication was cited in the 2024 AHA statement. And the AHA, if you look at the imaging guidelines, now they mention that CTCA should be considered in Kawasaki disease in several situations. This is a more recent publication from Dr. Manful on imaging of the left circumflex coronary artery, an artery that can often be missed during routine imaging by echocardiography. These are two review articles. The first one was published in Archives, and this was done in collaboration with Dr. David Bergner from Australia. And this was the first publication made by Dr. Vignesh when he joined us for his DM. And this publication now has upwards of 400 citations. And in this publication, Dr. Bergner basically concluded that Kawasaki disease now appears to be the commonest vasculitis and the most frequent cause of pediatric acquired heart disease. This was the first time that such a statement was made in the literature, that rheumatic fever no longer is the commonest cause. It is Kawasaki disease which is the commonest cause. This was in 2015. And this publication again, which is basically the work of Dr. Jayakantan, when he was working at CMC Vellore with his mentor, Dr. Debashish Danda. This was Dr. Danda's idea right in the thick of the COVID pandemic, that he said that we should write a review article on this. And this publication is very dear to me because this is one amongst the last few publications by Dr. Danda before he tragically passed away. And this publication, over a very short time, again has had more than 400 citations. Dr. Jayakantan is here attending this conference, and he is a molecular biologist working in our biochemistry laboratory at Chandigarh now. In 2017, that was the 50th anniversary of the first report of Kawasaki disease. So we requested the editor of the International Journal of Rheumatic Diseases if we could have a special issue on Kawasaki disease. And this special issue, the guest editor was none other than Dr. Kawasaki himself. So it had 16 articles written by the who's who of Kawasaki disease the world over. And it had articles by Dr. Kawasaki, Dr. Kato, and he called this his title was Tomisaku Kawasaki, My Teacher and a Friend. This special issue of the IJRD so far has had more than 1,200 citations. At Chandigarh, we have also been organizing the special programs called the Global Initiative of Academic Network Programs on Kawasaki Disease, which are funded by the Ministry of Education, Government of India. And we have had the privilege and the honor of having Dr. Hiromichi Hamada in 23 and Dr. Etsuko Suda earlier this year. And Dr. Hamada and Dr. Suda spent 6 days with us lecturing on Kawasaki disease, morning till evening, 6 days at a stretch. So this was our first patient with Kawasaki disease in June 94, which we published in 1996. And he's now become a young man. He's a computer engineer. He was working for several years in Southeast Asia in Laos. He's now back in Chandigarh. So I'll end my talk with what we remember most about the legend, Dr. Tomisaku Kawasaki. My most prized possession is this wall hanging that Dr. Kawasaki gifted to me on October 29, 2005. And this wall hanging adorned my office for 20 years. So any photograph that had to be taken in my office was always in front of this wall hanging. So here you can see Ms. Subura Kawasaki, Dr. Hamada when he had come, Dr. Adriana Tremole when he had come. So this is a priceless memory of Dr. Kawasaki. I had the privilege of having 4 manuscripts along with Dr. Kawasaki, 2009, 14, 16, and 17. And these remain my most privileged publications that I had the opportunity to write with him. my most prized remembrance is a desktop calendar that Dr. Kawasaki used to send regularly every year in early December. Somewhere between 1st to 7th December, we would receive a parcel from the Japan KD Research Center with a letter from Dr. Kawasaki and a beautifully designed desktop calendar year after year. Always between 1st and 7th September. And this had photographs crafted by Miss Aiko Shimojima, who was a long-term associate of Dr. Kawasaki and who used to draw out paintings for him and who also used to raise funds for children with Kawasaki disease. So this is what the calendar used to look like. But in 2019, on 4th December, when we received this calendar, it had a special note from Dr. Kawasaki. And that note looked somewhat unusual. It read, I also decided to take a rest for a while. And Dr. Yoshio Imada, my long-time colleague, would take my place as a director of Japan Kawasaki Disease Research Center, thereby indicating that this is the last time that I would be sending this calendar. I received this calendar and I felt that something was wrong. And did Dr. Kawasaki have a premonition of what was to come a few months later? I seriously think that he really had a premonition. So I have kept this letter with me. Dr. Kawasaki had a legacy like none other. He described a disease which was to change the way pediatric cardiology was looked at. He described a disease which changed the way children with fever would be looked at, all based on his clinical observations, all based on his meticulous record keeping. He had to face a lot of opposition because his own colleagues in Japan initially did not believe that what he was describing was something new. So this is from Ms. Subura Kawasaki. At first, no one understood his inspiration, but he believed in himself and proved his belief. And these are Dr. Kawasaki's own words, be unique, not imitating others. So this is what we owe to this legend from Tokyo, who single-handedly, virtually discovered a new disease. And we in India have had the privilege and the honor of seeing him face to face, and he blessed us by coming all the way from Tokyo in 2005 when he was no less than 80 years old at that time. This is Dr. Kawasaki with his mentor, Dr. Fumio Kosaki, who encouraged him to write this paper, but who withdrew his name from the authorship, saying that this is your work, you should publish this. Dr. Kawasaki, according to Ms. Subura Kawasaki, he used to visit Dr. Kosaki every year, and Dr. Kosaki lived to be 100 years. The final phase, this photograph again has been sent by Ms. Subura Kawasaki. This is a few weeks prior to his death. And this is none other than Dr. Hirohisa Kato wishing him well. And this is Dr. Kawasaki's family. His wife, Dr. Riko, had passed away the previous year in 2019. So this is one of the last few photographs of Dr. Kawasaki. But what you can't miss is the smile. That smile is always there. And this again is from his office with Ms. Sato-san and his longtime associate, and this is Ms. Subura Kawasaki after Dr. Kawasaki had passed away. I had the privilege of visiting his final resting place with Ms. Subura Kawasaki, and this is within walking distance from the Japanese Red Cross Medical Center, from where he first reported this disease. And this is again at the same place. So, according to Dr. Kawasaki, be strict while studying medicine, be warm-hearted while caring for patients. And he was very strict with himself, which you can make out by the way he penned his first manuscript, the detail in which he had gone. For instance, he had noted in his first patient that there was hemolytic anemia. That patient had a drop in hemoglobin. So we had no explanation at that time, but he has noted this, that this was Coombs positive hemolytic anemia. Imagine noticing that in 1961. That is how strict he was. So in February this year, we wrote a small editorial for the International Journal of Rheumatic Diseases on his 100th birth anniversary. That is February 7, 2025. So thank you very much, and thank you very much for this honor. Thank you.